Hi there. B11529 or Omicron poses very high global risk. The world must prepare, says the World Health Organization. Now, what is this new mutant? Possibly it is the worst mutation of the SARS-CoV-2 virus. Amidst that, the economy has opened up and so are the schools. But is it time to reconsider reopening of schools in several states? For example, in Karnataka and Andhra Pradesh, we're seeing cluster outbreaks in schools, especially. Joining me is Dr. Vishweshwaran. He's from Yashoda Hospital in Hyderabad. Doctor, if I can ask you about what recently has been reported out of Hyderabad in a government school, a cluster outbreak as far as our children are concerned. Do you think that the government, state governments should contemplate more before really reopening schools?
Yeah, definitely. With the current scenario of the scare of the Omicron, reopening of the schools will put the children at risk. So, definitely at the present time, we need to make sure we need to first understand the transmission capacity of this virus, the ability of this virus to cause infections in children, and the severity of the infection this virus can cause before we can start reopening all the schools. Having said that, we can utilize the other hybrid modes. We can limit the number of attendance in the schools, and we can make sure that every children is screened on day-to-day basis for the symptoms of COVID virus in case if we are reopening the schools. And another one thing which is of paramount importance and the government is taking a serious concern is regarding the vaccination of the children prior to reopening schools in most of the states. So that really becomes a primary concern, and more so during this scare of this Omicron. So reopening
Yes.
schools at this point of time, I think the government will be very cautious in issuing any guidelines on full reopening of the schools.
And especially because the government still has not come out with the protocols for vaccinating children. While we have a vaccine which is Zydus approved for 12 plus children, we also have a co-vaccine, but that's still waiting a nod from the Drug Controller General of India. Uh, do you think that it would be wise, Doctor, for parents to first vaccinate their children and then send them to schools?
Yes, definitely. Vaccination is the only mode of prevention from severity and the death associated with this COVID virus as of now. And even when the PM addressed the nation, they were particular that they will take into consideration the expert committee opinion and formulate the guidelines for vaccination with respect to the children. And as you rightly said, with the vaccines like Zydus coming into play for children more than 12 years, maybe in the near future, after the recommendations from the National Technical Advisory Committee, probably we may see the role of vaccination in these children. And that would be a real wise decision on the parents to vaccinate their children prior to sending them to school.
But what could be a possible reason for these sudden cluster outbreaks, especially in schools? We've seen that happen in Karnataka, and now we've seen that happen in Andhra Pradesh and Hyderabad as well.
So in India, as per the government reports, we still do not have this Omicron variant. So that might not be probably the reason for this outbreak of this cluster outbreaks. Having said that, now we have moved away. We have started socializing. We have opened up the borders, and even the adherence to the social pandemic norms has not been so effective as it used to be previously. And children's and adolescents are the groups which are still not yet vaccinated, so still they are susceptible to get infected with this COVID virus. So probably these are the few reasons: one, non-adherence to the social pandemic norms, and attending social gatherings, and as well as the susceptibility of the adolescent and the children to get this COVID virus because of non-vaccinated status might be the possible reasons for this cluster outbreak.
All right. Now, as far as the new variant is concerned, B11529, the World Health Organization has already labeled it as a variant of concern. It's called Omicron now. How much do we know about it? Very little, yes, and it's still under investigation. But whatever we know, for example, it has large mutations. How can that, A, what does large mutations mean? And B, mutation in the spike protein. What does that mean? And what is it capable of doing?
See, any virus for that matter is capable of mutations. That is a normal characteristic of any virus. So, because that is how the virus have to survive. So the coronavirus is no exception, and this variant, what we are speaking about, Omicron, was first reported on 24th November in South Africa. So what they found out was there were a lot of mutations in the major characteristics of the virus, which are capable of increasing its transmissibility, and possibly it can lead to serious infections. That is why the WHO has clearly called it as a variant of concern, because this is capable of behaving in a different way and it may have an effect on the vaccine efficacy and even the transmissibility. So as on today, as per the WHO statement, this virus variant of virus is capable of an increased transmission, so people may be prone for COVID-19 reinfection. But however, with respect to the severity and the mortality associated with this virus, we still do not have any data to say this virus is much severe than the existing Delta variant, and whether it will contribute to more mortality is also not known. So that will take few weeks to months to understand what is the severity that it can bring about in a patient who is infected. But having said that, they have found that the current existing RT-PCR can still detect these variants, which is a very good sign, because we need not depend upon only genomic sequencing, which may take a long time. And in a country like India, where the amount of population is so high, it will be almost impossible to genosequence all these COVID variants. So we can still pick it up with this RT-PCR, because it has a particular characteristic which is referred to as the gene S dropout. That means in a COVID RT-PCR screening, we look for three main genes of the virus. One is called as the N virus, another one is called as an RDRP gene, and the third one is the S gene. If the S gene is absent or there is an S gene dropout, then your RT-PCR can easily pick up. Probably you are dealing with a case of a Omicron variant. And with respect to the vaccines, we still do not know whether the virus has a capacity to evade the immune response produced by the vaccine. But even now, the WHO has clearly said that vaccine is the only means of preventing the serious and even the severity of the virus. So we need to get ourselves vaccinated. We need to look into vaccinating more of the susceptible population. And with the recommendations from the expert committee, maybe we may see a role of vaccination in children and even a possibility of a booster dose maybe in the future, given the possibility of recurring mutations.
Till now, the World Health Organization as well as UNICEF has maintained that it is indeed a idea to open up schools, considering the closure of schools for so long has also had mental health implications on many children. But now, with the new variant around the corner, with now many countries, European countries especially, reeling under the impact of the fourth wave, and with this new scare really now, possibly the worst mutant of SARS-CoV-2, do you think that reopening of schools should, in fact, only be thought of once vaccinations for children is in place, once children are vaccinated? Because up till now, the idea, doctor, really was that as long as the school staff, the para staff, the teachers, everybody is vaccinated, it's okay for children to go to school.
So yes, with the given with uncertainty, I think it would be wiser if we have an access to vaccinating children in the near future. And anytime having a vaccinated child is much better, because it is going to prevent them from getting at least the serious forms of the COVID-19 infection, which we are really worried about. But having said that, there are a lot of practical issues when it comes to place. How soon are we going to vaccinate all the children? And do we have that much of logistics in us to meet this requirement? These are the questions that still remains unanswered, and probably the time is the only answer for it. But given the uncertainty, I think moving again back to the hybrid modes of education and limiting the school attendance, probably you can have a shift system and frequent monitoring of the children's by the parents as well as the teachers in schools, and maybe ensuring periodic RT-PCRs in susceptible children's, probably maybe what is doable at this point of time. But with the near future, with more guidance from the expert committee, we may see a role of vaccination even in these susceptible population.
All right. Doctor, I'd also like to ask you about, parents who already started sending their children to school. Many states, remember, for the last couple of months have, in a very phased manner, started opening up schools. Now, with the scare of the new variant, there are some nationals from South Africa. In fact, some incoming passengers from South Africa who tested positive in Karnataka, for example. Of course, the genome sequences is happening and the results are due. But do you think it would be wise for parents to halt the um, the whole procedure of sending their children back to school at least for a while before we have more clarity on the B1152 variant?
At an individual level, yes, that would be a wiser choice if you have an access to a hybrid mode of education. But having said that, that logistic facility is not available is not accessible for all. So we need to find a midway where we need to mitigate this adverse effects of the COVID infection. At the same time, we need to make sure that the education doesn't suffer. So we need to put a policy in place, an interim policy in place till the time these children get vaccinated. Maybe, as I said before, you need to bring about more of infrastructure changes in the schools. You need to bring about more awareness amongst the parents in screening for symptoms, and you need to make sure there are adequate facilities for social distancing and hand sanitization and mask. So that is some midway we need to reach before we have an access for the entire children to get vaccinated. But in a given scenario and in an uncertain scenario, if you have an access to a hybrid, then probably I would feel like that is a better option than having a physical class.
Thank you, doctor, so much for joining us. And like the doctor here is pointing out that perhaps it's a good idea to wait before you get your children vaccinated and then send them to school. The government is still to come up with a policy as far as vaccinating children is concerned. What I've been given to understand is that sometime in the first quarter of 2022 is when healthy children could get vaccinated. But before that, the hope really is that for vulnerable children, for children who are immunocompromised, at least they should start getting vaccinated. That really is the hope. And with the new variant round the corner, the message from Network 18 to all of you really is that it is time to go back to basics. It is time to start wearing your mask, not just a single mask, your double mask. And all those people who've not taken their second dose, which is due for them, now is the time. Thank you so much for watching.